Okay, guys, so one of the most common questions I get as a chiropractor is what exactly is the crack? And there are a lot of misconceptions about what it is. And one of the main ones is that there are just bones that are, snapping back into place. And really what it is the joints that we adjust are called synovial joints. They're fluid-filled cavities, and when we adjust a joint, okay, or a joint complex, those surfaces separate, and when those surfaces of the two bones, basically with the cartilage on the ends of them, separate, okay, it's happening within a cavity with fluid, and that's creating a pressure change or a drop in pressure. That drop in pressure also leads to gases that are created, and then those gases are released, and there is the pop sound. It used to be referred to more commonly as cavitation, and that's still very common. And now it's really more mainstream definition of it is tribonucleation. But what's important is that it's a natural process of joints moving, and sometimes it'll happen incidentally. If you get a massage and joints move a certain way, or you twist and turn a certain way, or sometimes patients do try to self-adjust, and there will be that noise as well. It's just important to understand that it's a byproduct of an adjustment, but it's not exactly the adjustment. Okay, so now you may be wondering, if the chiropractic adjustment is not the noise, then what exactly is happening? And that's a really good question. And the answer is that once it's clinically indicated after an examination that a patient is a good candidate for a trial of chiropractic care, an adjustment can be used as part of the treatment plan. And an adjustment is a controlled force delivered to a joint. And when we do that, we make that joint move. And the information that's being relayed through your nervous system from that area has to do with muscles that are stretching, and also information from nerves being relayed about how that joint is moving rapidly because of the adjustment. And then the well-documented effect or effects are neurophysiological, and not even as much attributed to mechanical movement. And what I mean by that is that there are short-term demonstrated reductions in pain from an adjustment, and also range of motion increases because there's an inhibition of the muscles in that area. So there's less guarding, and what we will typically see in practice is a patient that maybe had a limited range of motion in a certain direction, all of a sudden can move freely without pain or with very diminished pain. Now again, they're typically short term, and it's ultimately the responsibility of the chiropractor to determine how to dose that treatment out. And that depends on the patient's existing condition, their history, and as well as that, their tolerance to the adjustment and how they basically did afterward. So it is something that is a dose-dependent medium, and ultimately it's your doctor's responsibility to determine how to administer that treatment effectively. If there wasn't any noise, did the adjustment work? And that's a question I'm sure many chiropractors, if not all, have heard at some point in time. And the answer is yes, you can still have a successful chiropractic adjustment without noise. Some joints move easier than others, and some joints tend to make noise more than others. And also depending on the patient's condition, and as well as their propensity to try and self-adjust, that will also have some impact on those things. Some patients are constantly trying to move and self-adjust, sometimes even right up until their visit when they come in and see their doctor. And if you've just twisted and turned and created some noise in your back, chances are it's going to be reduced by the time you see the doctor, if make any noise at all. But what we're really looking for is an improvement in function of that joint level. And what I have seen in practice is, regardless of noise, a patient may get up from the table and still be able to move with less pain and increase joint range of motion thanks to the adjustment. And oftentimes that's the first time they've ever had someone point that out to them, and they've wondered, by seeing other practitioners, and maybe there wasn't noise made during a certain adjustment or a certain area of their spine, if that was something that wasn't successful because of it. So yes, you can still get adjusted without noise. Yes, you can still have the effects that I had mentioned before that can be beneficial. Are louder cracks or more pops better as far as treatment goes? And the answer is no. What actually would drive a more positive treatment response is sound clinical reasoning and a more targeted approach to adjusting specific regions rather than chasing noise for some form of reassurance. And another popular question I've heard over the years is, can I adjust myself? And most chiropractors would tell you the answer is no, or that it's not quite the same thing as a skilled practitioner's hands. And some of this, again, can come back to the noise that I think is experienced and the assumption that cracking knuckles or a joint that releases gas is the same thing as the force specifically delivered by a doctor of chiropractic in an adjustment. And we know that those things obviously are not the same thing, okay? The gas, again, is just a byproduct of the adjustment, but not a requirement. And to understand what happens in an adjustment a little bit further, let's think about the joint that we're adjusting, and we already know that it doesn't move well, okay? So every joint has a certain range of motion that's acceptable. Let's use my wrist, for example. Okay, it should move a certain direction, and once it gets past that level, I could hurt myself. So the normal joint range of motion, if you imagine a 0 to 60 speedometer, that's normal range of motion that's acceptable and typical. Once we get past that point, up to, let's say, 75 miles an hour, 61 to 75, that would be what's considered the paraphysiological space. That is a place that is different and outside the bounds of normal joint range of motion. Once we get past that, from 76 miles an hour on, we're in a place called the anatomical limit. That is where joint injury can take place. So most chiropractors would say that unskilled hands and untrained hands shouldn't try to adjust, as there's no reason to put yourself at risk. But when we do adjust you, okay, we're very skillfully adjusting that joint within that realm of joint safety. And in that paraphysiological space is where the benefits that I spoke of earlier are believed to occur. So can you get joint range of motion? Can you move joints that move pretty well already to make noise and provide some form of relief? I think most people would tell you yes, but that's very difficult, very different than a targeted approach to moving certain segments that already don't move well while leaving other areas that already do move well to continue to move well. So I think that is probably one of the bigger questions that I do hear as well. It might even be number one, to be honest. I know a lot of times patients do feel that they adjust on their own and they get benefit from it, but my advice is typically that a chiropractic adjustment is also typically a part of tools that we use, including lifestyle modification, stretching and strengthening, and addressing some of the functional limitations so you move better with the adjustment, a part of that, rather than I feel like my back is tight, therefore I should try to crack it. So that would just be my advice as a clinician. All right, and finally, how long do the effects of an adjustment actually last? And there really is no clear consensus, and I think the best course of action is to have realistic expectations. There are patients who recover very quickly and get very drastic results from chiropractic care, and there are others where it takes more time. As I mentioned earlier, the neurophysiological effects of an adjustment typically are short-term, and an adjustment itself is really a piece of a larger treatment plan. One adjustment is not the treatment plan. The treatment plan takes time, and there is a dose of chiropractic care that the doctor has determined would be best to try and help you. So I wouldn't hang your hat on one adjustment. And I guess in terms of clinical observation, I would say it's more likely than not that patients that come in with higher levels of dysfunction and pain usually are going to feel a less significant beneficial effect from the first adjustment or the first few adjustments. But again, that's only one observation, and there are multiple factors. So just at the end of the day, stay realistic, stay committed to the treatment plan until there's reason to not be. And I think that's usually going to be the best measure of how successful chiropractic care is toward getting you to a place of greater function, less pain, and greater independence.